Did you see what Tina Tubbs saw?
Okay. The lovely assistants, the crazy grandmother, lesbian friend, audience. Okay.
Oh, Marty, damn, our secret's out.
Okay. Hey, how's this going, dear? Okay. Are you ready? Okay.
You cannot call
Okay.
her Sean.
I think I'm going to be single really soon, so.
I'd like to talk to you about blood pressure. I'm sure most of you can relate to your blood pressure in some way. Have you ever stood up and felt dizzy? Have you ever felt sweaty, warm, or even flushed? This is because there was a sudden change in your blood pressure in some way. I have been a CNA for 3.5 years. That stands for Certified Nursing Assistant. I work in a long-term care facility, which is also known as a nursing home. One of my duties as a CNA is to obtain vital signs on our patients or our residents. One of the most important vital signs is blood pressure. It is my intentions to inform you of normal blood pressure ranges, factors that affect blood pressure, and the equipment used, and also a demonstration to show you how to measure and obtain blood pressure. First of all, a normal blood pressure range should be around 120. That would be the top number. The top number is known as the systolic number. This is actually the most important number according to the American Heart Association in people over the age of 50. That's when cardiovascular disease would become present if your blood pressure was high. The bottom number of blood pressure is known as the diastolic. A good number, a good normal range for that would be around 80. Hypertension is what is known as high blood pressure. Hypertension would be a number such as 140/90. You would have high blood pressure if that was your reading. Hypotension is low blood pressure. A number for low blood pressure would be 90/60. Factors affecting blood pressure. There's 3 main factors that affect blood pressure. One is your age. When you're younger, your blood pressure is lower, and as you get older, your blood pressure is higher. Another factor is your gender. Women tend to have a lower blood pressure than what males do. Also, another factor is stress. Stress causes your blood pressure to be very high. Also, there's self-induced blood pressures that can make your blood pressure be abnormal. One of those things would be consumption of alcohol that can cause your blood pressure to be high. Also, smoking is another factor that can cause your blood pressure to be high. And also your diet. Those 3 things can cause abnormal ranges in your blood pressure. The equipment used to obtain a blood pressure reading is a stethoscope. This is actually the bell of the stethoscope, whether it's open or closed. When it's open, that's when you can hear the sounds of the heartbeat through the arteries in the arm. These are the earpieces right here. Another piece of equipment is the blood pressure cuff, known as the sphygmomanometer. This is actually the cuff that wraps around the upper part of the arm. There's a gauge that has all the numbers on it. It actually goes up to 300. That would be pretty crazy blood pressure to have. I had to go all the way to 300. This is the bulb that you use to pump up the cuff with. And then this is the valve that releases the air. Mosby's textbook for nursing assistants says never to inflate the cuff too high to where it causes discomfort. The higher the inflation, the greater the discomfort. So you never want to do that to one of your patients. So now I'd like to demonstrate on my assistant Sarah here how to do this. I'm actually not going to take her blood pressure because this is an adult cuff. I would actually need a smaller cuff for her. Put it on here. Stethoscope is placed right under the cuff, right in here. brachial artery runs down this side of the arm and this side of the arm. When the blood pressure cuff is inflated, you actually will not hear a heartbeat while you're inflating it. And the very first heartbeat that you hear, that is the top number. And as you slowly start to release the valve, release the air, you do it slowly. And when you hear the last heartbeat, that is the bottom number. So this is how that blood pressure is taken when a doctor or your CNA or any healthcare professional, when they take your blood pressure, this is what's going on when they actually. Okay. I hope I have helped you better understand blood pressure by knowing what is the normal range, the things you can do to avoid abnormal ranges, learning about the equipment used, and by being able to see a demonstration of how blood pressure is done. You can now have a part in managing your blood pressure, which is one of the most important vital signs in your body.
Wow. I'm impressed.
See if I can behave this time.
There's stuff that I didn't
Okay,
even know in there.
let's try this, David. Grandma's friend that won't talk to me no
My
more.
lesbian friend.
Okay.
I've seen her dance when she's drunk. She's not like it.